Good morning, good afternoon, and good evening, everyone, and welcome to UCSF Center for Global Nursing's Global Nursing Impact Series. This series aims to provide a platform for our nurses and global partners to share their remarkable work, offer valuable insights, and inspire our global community. Following this presentation, there will be a short Q&A, so feel free to write your questions throughout the chat in the Q&A box. My name is Rebecca Silvers, and I'm the director for the Center for Global Nursing. I'm joining you today from Helsinki, Finland, where we are attending the International Council of Nurses meeting. And it is my pleasure to introduce this month's speaker, Dr. Linda Franck. Dr. Franck is an internationally recognized nurse scientist, educator, and advocate for patient-centered care. Patient-centered care and health equity. She holds the Jack and Elaine Cohn Endowed Chair in Pediatric Nursing at the UCSF School of Nursing. She's also an affiliate faculty and member with the UCSF Bixby Center for Global Reproductive Health at the Institute for Health Policy Studies and with us at the Center for Global Nursing. Her program of research aims to improve healthcare quality and influence policy globally to advance health equity and outcomes for infants, children, and people of reproductive age. Her work spans neonatal and pediatric pain management, patient and family engagement, and implementation science. She's worked in global partnerships to develop innovative nursing solutions and capacity building efforts that improve the quality and equity of care. Dr. Franck is also a fellow of the American Academy of Nursing and a passionate mentor dedicated to shaping the next generation of nurse leaders and scholars across the globe. We are very delighted to welcome Dr. Linda Franck as this month's Impact speaker. Dr. Franck, I'll have you take it away.
Okay, thank you, Rebecca, for that very nice introductions. And it's great to see UCSF Nursing represented at the ICN conference. So that's fantastic. So hello, everyone. Good morning, good afternoon, good evening, wherever you are. I'm very pleased to be here to talk to you about some current research that we're doing globally in family-centered care. I'm hoping everyone's familiar, has heard of family-centered care, but I'll just start with a couple of introduction framing slides for that, and then share some of our current studies and focus on maybe some tidbits about doing research globally in the current uh, era, and also I have some hot off the press findings to share with you, just to give you a few little teasers about what we're learning from our research, and invite your input and potentially collaboration in the future if you're interested. I will ask, though, that people not take photographs or screenshots of the slides. There are some photos that I just have permission to share in education, but not to distribute. And also, the new findings that I'll be sharing with you are not yet published. So these are embargoed results. Yeah, hopefully it'll all be released very shortly. Okay, so let's just start with a couple of definitions, just so we're all thinking about things in a similar way. It's always important, I think, to define what we mean by a family, because obviously that varies, not just worldwide, but just individually, and how people think about what their family is, how it's constituted. But in terms of healthcare and healthcare service, it's important that we think about the family as defined by the people who you're working with and who are there for healthcare or for social care. That families are constituted by the people that are there, and by their relationships, defined by the patient or as their surrogate. So obviously, we have patients that we care for that are either minors or don't have decision-making capacity, either due to language barrier, developmentally, children who don't have language yet, or those adults or elderly people who have cognitive or language impairment. So they will have surrogate members who care for them, have their best interest in mind. I think it's important to highlight that family members may or may not be related to the patient. They may be, very, very close friends. They're the people who care and support the patient when they're receiving care. And we need to think about family broadly and not just as a legalistic definition or a societal definition, because families are as varied as we are all around the world. A second area of definition is then what is patient and family-centered care. I think in some ways it's self-evident, but I think it's very important that we frequently revisit the key components. I draw these from the Institute for Patient and Family-Centered Care. They have an amazing website with a huge number of resources around patient and family-centered care. So I always refer people to those resources if you are interested in learning more. But the core concepts have to do with dignity and respect in all healthcare encounters, that we as healthcare providers communicate and share complete and unbiased information with patients and families, and do so in a way that is affirming and useful. And again, we'll come back to this during the course of the conversation. Because it's a very key and sometimes misunderstood principle of family-centered care. Patient families are encouraged and supported to participate in care and decision-making at the level that they choose. So again, choice and are really important. And collaboration in patient family-centered care isn't just at the bedside, it's at all aspects of healthcare delivery, including policy and program development, quality improvement, safety, professional education, and research. So we make sure that we do patient and family partnership or centered care in all aspects of healthcare decision making. As I'm talking, I'm also wanting to highlight that there are a lot of different terms or related terms for patient and family centered care. Some of the ones that you hear globally are things like humanization or humanistic care. You'll hear respectful care as another related term for patient and family centered care. I'd love to hear what other terms you've encountered, and we can discuss, how similar or different they are, and if they do encompass the four principles, or what makes them, you know, a related but not identical term. But I think worldwide, what's so interesting is that patient and family-centered care is a global concept, a global philosophy, if you will, a global healthcare delivery model. And it's found its way into every corner of healthcare that I've encountered globally. And again, I'd love to hear your experience or how it's interpreted in the global work that you do. That's like the formal definition. I think an informal, easy to remember, and I think really powerful way of thinking about family-centered care is the catchphrase "Nothing about us without us." Now, this came out of the 1970s, and in pediatrics, the families of children with disabilities who were feeling very disenfranchised, unempowered, very much objects of care when their children were when they were trying to advocate for both healthcare, social care, educational care for their children. And just historically, other major phenomena were going on where people felt very disconnected and disempowered in their own healthcare. And this phrase came about and is still very powerful and present today. So when you're thinking about, am I doing family-centered care, or can we be in our healthcare service or healthcare delivery, can we be more family-centered? I think you just need to connect with this, bring this phrase to mind and say, are they included? How are we including patients, families, and community, I would add? Are they part of what we're doing? How can we engage them more fully? How can we be more partnered so that there truly is nothing about us without us? Okay. So now just a little bit about the evidence about why this matters, why we should care about this, why we should push so hard to see that patient and family centered care is happening authentically. It's because the evidence is very, very strong, and particularly in pediatrics, where I spend most of my work life, is that the evidence is very strong that it affects and improves outcomes for the child themselves, for their family, and actually for the healthcare system. So the benefits are well established, decades of research that behind this. So I don't really have time to go over it in this talk. But here's like one classic reference from the American Academy of Pediatrics that can point you to some of the reference, and there are many others as well. I'll just mention one other thing about terms as I'm thinking about this. We talk about patient and family-centered care. We often, and especially me, will often shorten it to just family-centered care, particularly in the pediatric space, where the focus is on the family involvement when you're particularly working with very, very young children. But just know that if I say family-centered care, I also mean patient and family-centered care. Here's another slide just to highlight some of the ways in which patient family centered care, the research is so mature that it's now made it into major government healthcare policy, really literally around the world. In the US, the Center for Medicare and Medicaid actually has it calculated in their formula for reimbursement for hospitals. So there are financial and resource incentives to practice family-centered care at an organizational level, because they do look at patient experience and engagement in their calculus of value and figuring out how to resource the health system. Similarly, in Canada, there are very strong standards. Canada has the Better Together program, and has really championed this issue that families and loved ones are not visitors. They are essential care partners, and really focusing on our use of language and changing that perception in terms of how healthcare is delivered. And then PCORI in the US as well. Australia has standards. The European countries have standards. Many countries have standards around patient and family-centered care as the model of care. And globally, the WHO has their model of what they call integrated people-centered health services. So again, another variant on the term of patient and family-centered care, but clearly showing the person receiving the care as the center, with the family, community, and health services all designed around and supporting them. So again, this is another key reference for you if you're looking for uh, resource and research literature to support your efforts around improving patient and family-centered care. I also just want to highlight the issue around care setting, because I think it's common to sort of focus on the extremes, if you will. People will say, "Oh, you can only do patient and family-centered care or family-centered care when you're in a high resource setting and you have all the technology and you have the health professions, and then they have time or capacity to engage and involve the family." But I also hear the other way around that, family-centered care really is when you don't have any health professions and you just have the family member who is really the primary deliverer of the health service, and you're, in a very, very low resource setting or something in between. And the answer is it's all of the above. There are amazing examples of family-centered care in high resource, medium resource, and low resource settings. And the research and learning around family-centered care is really bidirectional and global. So, for example, these examples here of what we see as kangaroo care or kangaroo mother care, as it's sometimes called. Some of the groundbreaking research around this truly family-centered, family-partnered healthcare technique came from very, very low resource settings, and had to be translated into how it would work in a high resource setting. And we're still trying to make that transition. Whereas other innovations around family-centered care have happened in high resource settings and then been spread out to other settings. So setting is important in that you will need to customize or locally adapt, look at what the local issues, customs, and cultures are for your family-centered care interventions. But the concept itself, the practice itself, the principles itself are truly universal around the world. So we talk about, oh, I guess one other thing I wanted to point out here, I'll just go back for a second. And the one thing I just wanted to highlight right away is that this is also, although it's not in the name, is really nursing care. Nurses are really at the front lines of providing and advocating for patient and family centered care. Nurses are the ones who can be the primary facilitators of family-centered care. We can also be the primary barriers of family-centered care. And so we have a really key and pivotal role in this healthcare delivery. But we can't do it alone, and the healthcare system can't do it alone because, as we've learned through our research, that many of the barriers to patient and family-centered care, some of them are institutional, some of them are within the family and their attitudes and lack of knowledge about the role that they can and ideally could play. But also, some of them are just about the disconnection between health and social services in many of the countries that we work with. So, to be truly family centered and to practice truly family centered nursing care, we also have to dip our toe and get immersed in social care issues that affect families, because some of these things, I've just listed a few here, are the things that really prevent families from truly being partnered and engaged in healthcare with their loved ones. So getting to our research, we've partnered, myself and my research group at UCSF have partnered with the Ronald McDonald House Charities, which are a global charity operating in over 62 countries with over 400 houses, as well as many, many more mobile programs that provide social support and social care to meet the needs of families of hospitalized children. And so this is a little bit about what they do, in their, people know them for their houses, but it's really their programming that makes such an amazing impact in helping families keep close to their hospitalized children while still meeting the needs of their families, the rest of their family, which doesn't stop when their child is hospitalized, and making sure that they don't fall through the social safety net because of this incredible stressor that they're experiencing. They serve children families of children who have chronic illnesses, who have to travel long distances to receive specialty health care. And as they say, they're a worldwide global charity. And they have been our research partner for a number of years to try to understand more deeply how we can impact and improve family-centered care. Now, you will, I'm sure, still remember that we had a big global disaster not too long ago that impacted healthcare worldwide, but it also really impacted family-centered care. And many, many hospitals, unfortunately, took the decision to abandon their commitment to family-centered care during at least some of the initial months of the pandemic and some for a protracted period. There are exceptions to that. There are hospitals that also chose to prioritize and retain family-centered care and partnered with families to help with addressing the crisis of the pandemic. But it created, if you will, a very unfortunate but a learning opportunity as a natural or unnatural experiment to see what happens when family-centered care is at least partially or fully disrupted. So we know from these are just a couple of reports that came out that there are, from this experiment, if you will, we learned how, we learned what happens when you don't have family-centered care or when family-centered care is suddenly disrupted, and the harms that happen to patients, to families, and to the healthcare team. This from the American Nurses Foundation showed some of the harms to nurses and their ability to do their work from not having families as partners in care. So we at the UCSF Patient and Family Centered Research Center and with our partner, Ronald McDonald House Charities, we wanted to understand what in the post-pandemic world, what family-centered care looked like across pediatrics and globally. So I'm just going to highlight just a couple of little studies that we've done and just give you a few little teasers about them. We've done two recent studies, one looking at hospital leaders to investigate hospital family-centered care culture, attitudes, and practices in the post-pandemic world, and to try to really understand what is the current global context around family-centered care. And the second is called the Learning from Family Studies, where we're really trying to understand the strengths, needs, and experience of families who are served by the Ronald McDonald House Charities globally and see what we can learn about what's universal, what's regionally specific, and get some ideas of where we can go to try to improve family-centered care. So first, just a little bit about what we learned from the survey of hospital leaders. And again, these results have been submitted for publication, so I ask that you not copy them down. But first of all, the good news is we've learned that family-centered care is a priority. The majority of hospital leaders from this survey of 215 leaders from 38 countries showed that it is a priority. They felt that partnerships with the Ronald McDonald House Charities and other social care groups that provide social support for families, in addition to Ronald McDonald House Charities, those services improve family-centered care. So having that partnership with social care was important. Importantly, an active patient and family advisory council was strongly associated with higher scores on the hospital family-centered care survey that we developed. And so this is, I think, a really interesting opportunity for intervention to promote patient and family participation at an organizational level to try to influence family-centered care across the whole interventions. And out of this, we created and did some preliminary validation on a survey tool that we believe can be used globally to continue to track both trends in family-centered care as well as for others who want to do trials or other intervention research can now have at least a preliminarily validated measure to look for effect changes. So that's just briefly about that one study. And then just a few comments about the learning from family studies. This is a really big study that's now first wave is finished, and now we're continuing to enroll. But this is to really get a very holistic perspective of the strengths needs of families served by Ronald McDonald House Charities, which represent really the most critically ill, longer stay patients that have to travel the farthest distance. The entry criteria were that caregivers of children who had a minimum of a 3-night stay at the Ronald McDonald House. Many of them had been staying at the bedside or elsewhere prior to the study. Their children had been hospitalized for some weeks. We've done 3 surveys with them longitudinally at enrollment, when their child gets discharged and 3 months after discharge. And we have, through generous support, been able to at least acknowledge partially the family's contribution to the research. For the first wave of the study, we have over 3,000 families who have participated at these different time points. It involved 15 countries, 26 chapters of the Ronald McDonald House Charities, and 35 houses. Here's where it shows that. And this I'll probably skip over, but we conducted the study in 10 languages to really try to get language diversity as well as geographic diversity, and we offered it by email, SMS, and paper. So this just shows that families really do require different types of research engagement. We can't just depend on virtual exclusively, otherwise we'll miss key groups of families. I'll skip over this for time. Again, some embargoed results, but just a couple of things to whet your appetite around this, the research that and the findings that we'll be learning. Surprising to me, just the level of need of families when their child comes to receive specialty hospital care. Half the families are living about below the poverty line for their country. 1 in 3 of them have at least one unmet basic need. And this, I think, is really something we need to pay attention to, that 3 out of 5 families had clinically significant anxiety and depression symptoms. Now, that is a trend we see worldwide, that anxiety and depression are higher globally. But this is quite an astounding number, and it's not explained solely by just the worry or concern about their child's illness. Our statistical team has done quite a lot of interesting modeling on this, and those results will be forthcoming. But on the good news side, what we also have learned from this study is that there are ways to buffer those really harmful impacts of both the social situation that families find themselves in and their child's, often critical illness. So having social support, having the ability to do self-care, like get a good night's sleep, have a meal for, get some food, healthy nutrition, being able to do something for themselves, and family-centered care at the hospital were strongly correlated with better mental health. So I think this is really exciting, and we're going to be, again, digging into this more deeply, and it would invite you to think about how you and your work and we together might look at what nursing can do to support and buffer families and protect mental health worldwide. We're currently doing a longitudinal study of these families to see what happens over the years since that initial hospitalization. And we've modified and improved our survey and our survey technique, and are continuing to expand to other countries so we can truly get a global picture of pediatric family-centered care. So just to wrap up, I just want to go back to nursing and nursing's role in family-centered care. We know from the research that we already have, and what we've learned so far with our study, nurses really are the ones who can help families understand how important they are to their child's care and well-being, and I would say to any loved one's care and well-being, regardless of age or setting of care. Nurses have a key role in teaching and encouraging and supporting families, figuring out how they can best be involved, that meets their needs, that meets the needs of their families, that works within the healthcare organization structure. But also we have a really, really important role in being an advocate for removing the barriers, the organization, structural, and societal barriers that prevent families from truly partnering in care, and be, on the front lines of helping healthcare systems have better policies and resources to support family-centered care. So with that, time went really quickly, and I hope we can spend a couple minutes talking. I'm sorry if I overstayed, but just wanted to leave with a slide from one of the participants and their value of family-centered care, and turn it back to Rebecca.
Thank you so much, Linda. This was an exciting presentation. As a pediatric nurse practitioner in critical care, I appreciate you. And I think it's really exciting to dive into this topic of family-centered care because, as you pointed out, nurses play such a large role. Whether you're caring in pediatrics or in adult medicine, I think families are just so central. And WHO today, we were talking about person-centered care. I think there's a lot of different terms. But I really appreciated your presentation today. One of the questions in the chat, we can do a few questions. We'll make time. But she said she's one of our nurses at Benioff Children's Hospitals and said, we hear a lot about parents' restrictions from work here in the U.S. and that limits their ability to be at the bedside in Canada as in other countries. Since you're doing global work, do you know if they have different leaves from work or how that impacts their ability to be with their hospital child and specifically for children that are in the hospital for longer term
Yeah.
admissions?
Yeah, that's a great point. And certainly, there's not a lot of really good literature on that. We know that, well, in some aspects, but not like a direct uh, uh, association with the participation. But certainly, families will tell you, and we know that the extended family leave policies and the financial support during family leave help families meet their basic needs. So in theory, they can be more involved. But what we see on the ground sometimes is that they don't always get there. And that's where the local policies around how families are approached and engaged and invited in and supported to be active participants. That's where that makes the difference. But certainly it is an enabling factor, something we really need to work towards in the US because it definitely has a positive impact and is most common in many, many other countries other than the US, unfortunately.
Yeah. Um, there aren't any other questions in the chat. I guess I'm wondering um, how did you develop this work with Ronald McDonald? Like, have they always been a global organization? Because I know them from our work here in the US, and I didn't realize that they were in so many countries. So when you had that map up, I was really impressed at the amount of work that they're doing across the globe. Um,
It's sort of the best kept secret. I mean, I worked in Europe for a decade, and that's how I knew that they were elsewhere. But as an American nurse for my training and early career, I didn't know that they were global at all. But yeah, and so hopefully, the word is getting out. But yes, they are in many, many countries and continuing to expand. They actually approached me because they were interested in understanding. They were hearing from families about how their present, there's the services that they provide to families help the families be more involved in their child's care. And so they were hearing from the health professionals in the partner hospitals that their support was essential to family-centered care. And they were curious to know more about that relationship. And so they came to me as a family-centered care researcher. And we started doing just some small studies, which has now grown into this larger program. And it's been a great partnership. And I've learned a lot as well about how to do global research. And so they provide the trusted community resource to help families engage more where they might not be so receptive to me as a random professor in a university approaching them to participate in research in some other country, right? So having that local trusted partner has been really a support for us to be able to do research on this scale.
And I think like it's just like a wonderful relationship. It magnifies everybody's work because for me, I see so many amazing organizations around the world doing wonderful things, but maybe not having that opportunity to measure their impact in the way that like you're
Yes.
helping that happen. And I think that's how we understand what we're doing matters. And I think when we're doing work across the globe in different places, like Ronald McDonald is, like you are, it's amazing to be able to track and to understand our impact. And I think that just creates a lot of conversation and volume around the work that's being done. And I think it just, your work is amplified, their work is amplified just by having that voice. And I think it's such remarkable work. It's exciting to see these preliminary results. I guess my last question to wrap up today for everyone is family, your thoughts on alternative terms. I mean, I love this conversation and I wish we had all day.
Yeah.
But like person-centered care versus family-centered care, like how does that feel,
I think there's room for all of it, right?
right?
I mean, one term is not going to be, I think we get too rigid about the terminology. There's not, again, I think, in global work, things have to be localized, customized to the setting. There's words have meaning and power in different languages. We've learned so much about what it means to do cross-cultural research, just trying to translate our surveys and luckily people have helped us sidestep some some major issues. But I think the important thing is that principles are the same and that the meaning is the same. So I think if we could, you know, make sure that when people do use the term, we take the next steps to say, what do you mean by that? Or let's make sure we have a common definition. And what does it mean to you? And what is, and how do you use it in practice? Because I think that's the more important thing, that we don't dilute the principles or make it so, that anything goes, if you will, and then we lose the power of the principles of it. So that's where I tend to be. And I just, try to keep a small collection, like, collecting shells, all the different names that people call family-centered care, just like all the different ways people say thank you, right? Or, you see that on the slide sometimes. We can have a collection of family-centered care terms, but that we still have the same core understanding of what it means.
Yeah, I love that. I think, and keeping that core helps us like understand when people say those terms, what we're implying and how that looks in research, and keeping those universal principles while the words might change is like
Yeah.
probably the most important. I love that. I thank you,
Yeah.
Dr. Frank, so much for joining us today and sharing your
Yeah.
expertise and your work. Thank you, everyone, for joining us. What a wonderful session. We'll be sharing it in case anybody wants to rewatch. And again, Dr. Frank, thank you so much for joining, and I hope everybody has a
Okay, thank
wonderful
you.
day.
And let us know what you learn at the ICN about. I'm sure there'll be many family-centered care
There's a whole
presentations.
two
So
sessions actually tomorrow.
great. Well, great. Thanks so much. All
Have a
right.
good
And
day,
I look forward to
everyone.
talking to anyone who has further interest. All right. Thanks. Bye-bye.
Thanks, everyone.